Today's tally in Victoria of 484 new cases is higher than at any point during this pandemic, breaking the record set on Friday. 2 full weeks since stage 3 lockdown was reimposed, cases are still going up. And so is the number of cases under investigation, over 2,000 in total, which poses an enormous challenge for contact tracers. Another challenge is getting people to stay home when they're not well. In the past fortnight, 9 out of 10 people who later tested positive for COVID-19 didn't isolate when they first noticed symptoms, and more than half didn't isolate while waiting for the results of their test.
And unless we have people who get tested staying at home and isolating until they get their results, then we will not see these numbers come down. They will continue to go up and up. And a 6-week shutdown will not be for 6 weeks. It will run for much longer than that.
With cases surging, more people are being hospitalised. There are now 205 people in hospital across Victoria, 40 of those in intensive care. James McCaw is a professor in mathematical biology and epidemiology at the University of Melbourne, and Professor Raina MacIntyre is the head of the biosecurity program at the Kirby Institute at the University of New South Wales. Welcome to both of you. Professor MacIntyre, first to you. Were you surprised by those figures showing that 9 out of 10 people aren't isolating and going for a test as soon as symptoms appear, and that half aren't isolating even after they've had a COVID test?
Yes, that's very disappointing, really. That could make all the difference between controlling the epidemic and not. It's really important that people comply with the directives to isolate and get tested.
How much of a factor do you think is fatigue or irritation with this having been going on now for quite a while?
I'm sure it is a factor. You know, people are fatigued. They're fed up, they want to get back to their normal lives, but the fact is life isn't normal, and the situation in Victoria is critical. We don't want to end up, in a situation where the health system's overwhelmed and we've got, a lot of preventable deaths because, people didn't do the right thing. I mean, the government can only do so much. It really is up to the population and the people to do their part as well.
Professor McCaw, people were shocked today by that high number in Victoria. Is the fluctuation between, say, numbers in their 200s and 300s versus 400s something to be seriously worried about?
So in terms of the numbers, it's the rate of growth is concerning and it's creeping up from 200, 250, 300, 350. That's a slow increase, but ultimately that increase will overwhelm the health system.
But it doesn't seem to be that kind of exponential increase that we've been told in the past is what is most concerning.
So it is actually an exponential increase. It's just a slow exponential increase. And with the, compared to global standards, the small numbers we have, they're still incredibly worrying, but they're small. It means that there's a lot of noise and a lot of random day-to-day fluctuation. So it's hard to see the exponential, but it's there.
Professor MacIntyre, the million-dollar question is whether New South Wales is about to follow Victoria's path. What do you think, based on what we're seeing?
It's certainly possible because there is community transmission. And if we think back to late June, the situation in Victoria was quite similar to what it is in New South Wales at the moment, where there were sort of double-digit numbers of cases. There was community transmission. It was initially thought to be localised and controllable, but then it sort of became apparent that it was spread far more widespread than just a few local clusters, and that's the concern with New South Wales.
Professor McCaw, in the Victorian cases, we're seeing every day that there's only a small number of cases that the contact tracers are being able to attach to known clusters. Why is that?
It's because it's out in the community. It's despite enormous efforts that have slowed the growth of the epidemic in the last month in Victoria, despite those successful efforts, it still hasn't been quite enough. And so as the virus spreads through the community in perhaps younger people who display milder symptoms, it's just harder and harder to pick up all of those epidemiological links, despite the enormous efforts that we go to.
Professor MacIntyre, when you look at the numbers in Victoria, is it where you thought they would be after 2 weeks of lockdown?
So 2 weeks is the average incubation period. In fact, most people incubate for about 5 days. So you really would expect to see the numbers to start coming down after 2 weeks. However, the transmission initially may have been more widespread than first apparent. And so I think we can, see what it's like next week, but perhaps some decisions should be made either late this week or early next week about where to from here if they're not coming down.
Professor McCaw, Professor MacIntyre, thank you very much.
It's a pleasure.
Thank you.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.